Okay, because I worked...
G'day, welcome back to Animal Hospital. You know, some of the animals that are brought in here by the inspectors have been rescued from unbelievable situations. But it seems no matter how long the inspectors do the job, they're always coming across something new. Gary Lucas had a very strange call the other day about a dog that was apparently being kept locked in the boot of a car. Shauna Lowry went with him.
Right, this one here?
Yep, that's the right registration number. Okay, let's bang on here. Can you hear anything?
No. A dog would bark if it was
Normally
trapped
hear some
inside.
whimpering maybe. Just have a look inside there.
It's locked.
Well, I can't hear anything.
It did seem extremely unlikely that there was an animal in the boot, but to make sure, Gary rang the police to see if they could trace the owner of the car.
A man was seen, young lad was seen, taking the dog out of this vehicle, out of the boot. About 10 minutes later, putting it back. And then was seen again, take the dog out and putting it in the boot. This was last night.
The police couldn't find any record of an owner. It seemed the car had been abandoned.
Yeah, we might be able to get through to the boot. It's,
Yeah, it's just there. Yeah, there is a dog in there. Hello, sweetie. I really didn't expect that. He didn't bark,
Hello?
he didn't move.
Hello?
Well, there's water here,
That's a thing.
but there's
Yeah,
no
but-
bowl.
You're right. So there's been absolutely no air being able to get in
Well,
here,
other
is
than
there?
from any gaps coming in through the boot, but it was extremely quiet.
Aww.
And it's just fortunate it's not a very hot day.
Okay, come out. Oh,
Amazingly, the dog seemed totally unaffected by its ordeal. Gary left the police to try and track down the man who'd locked the dog in the boot, while we took the dog back to the hospital. Chief Vet Tessa Bailey was on call.
he's a friendly chap, isn't she?
Very well behaved.
He's got some tartar on his teeth, so he's not really young. But he's probably kind of middle-aged, 4 to 6, something like that.
And he's quite chubby.
He is, he's a tubby chap.
So
He's been really well fed. Yeah.
What's going to happen to him?
I mean, physically, there don't seem to be any problems. We don't know when he last had food and drink, so we'll give him a drink and something to eat, and then he'll be transferred to a kennels while you find out who's been leaving him there.
It's cute, isn't he?
The RSPCA are still investigating that rather odd case. Now, it's always upsetting to see an animal that's been injured, but when you're an owner, it's even worse if the injury is caused by something that you did accidentally. Take the story of a hamster called Basil that was brought into vet Julie Taylor's clinic.
I caught him in the door, so I was going out the door, he came behind and I trapped him accidentally.
What area of him did you catch in the door?
His face.
His face. Right. Okay.
What sort of a door was it, Deborah?
Just a normal door in the sitting room. As I was going in, he was behind me, I didn't see him and closed the door on him because I let him run around.
So you let him out and wander about, huh?
I do, yeah.
Oh, look how bruised his tongue is. Can you see on there on the side how bruised his tongue is?
His teeth are moving. When I have him on the palm of my hand and he's eating the nuts, they just come apart.
His front teeth,
The bottom
right,
ones,
the bottom ones
yeah.
right in the front. Oh, I see what you mean. They do. When I touch them, they really wobble and look unsteady. I'm worried that he might have broken his jaw right across there at the bottom. So I think the best way to tell for us to, obviously, is to anesthetize him and x-ray his jaw, okay? If it looks like it's not too bad a break, we might be able to just keep him on soft foods for long enough and then let it heal on its own. But I think we have to see how bad the break looks to begin with. If he's got a break at all, he may not.
Is an operation feasible on a creature
Well, I mean,
that
it's
size?
such a tiny piece of bone. The size of pins and things that they make for orthopedics are just going to be too big for his jaw.
And if it does heal, he can eat solid, hard food again, can he?
Eventually, I would hope that he can eat hard foods again as well, but I think it's kind of time will tell.
No more competitions, I don't think.
Competitions?
Yeah.
Is he in competitions?
He's won a couple of rosettes.
Has
For
he?
what?
For being unusual.
Being a beautiful hamster. Yeah.
Once Basil was x-rayed, Julie had a better idea of how he was.
We've x-rayed his jaw, his lower jaw here, and there's no evidence of any fracture there at all, which is good news.
That's good, yeah. And the teeth, can you tell from that position whether they line up?
Not particularly from that so much because it's a one-dimensional view, but when we actually anaesthetised him and looked at his teeth, we clipped them and they lined up very well, and they were much more secure when they'd been trimmed back. They didn't wobble nearly as much.
And the tongue, that was
It was
very bruised.
bruised. It was bruised, but that should settle down with time.
A few days later, Basil was back at home, feeling much better and starting to tuck into his food.
When we first got him back from the vets, he had to mash up carrots and peas and cucumbers, but now he's starting to eat solid foods like his sunflower seeds and that.
I still let him run around, even after what happened, after I trapped him in the door, as I don't believe in those running balls. He needs exercise, and he just loves running around the house. Since the accident, I've put notices on the doors so that everybody knows that he's out and about, so that everybody's careful now. I'm just so glad that he's well and happy.
Sadly, many of the animals that come into the hospital don't have owners to look after them while they recover. And if they have been left with nasty injuries, it can be difficult to find them new homes. But last week I met a remarkable couple who are prepared to home badly injured cats. They'd recently taken on one that had been treated at the hospital after a road accident, and they brought it back to see vet Adam Jolly.
Who's this?
This is Viv. We adopted her a couple of weeks ago from here. And,
Just a couple of weeks ago, was it?
yeah, and she'd had her jaw rewired because she's been in an accident. And I've noticed that she's been pouring at the right side of her face.
Oh, she's a bit sore there, is she?
I think so. And then I've looked and checked, and she's actually a bit of wire sticking out from her bottom gum.
You can see that just down there.
Yeah, that's it.
That wire.
It's across the bottom.
It's quite loose now, so it's not really providing that much support anyway. I think from feeling and looking at it, it's healed so well externally. We'll take the wire off, and if it feels nice and steady, we'll leave it off altogether.
Okay, lovely, thank you.
How did you come to choose this particular cat?
I popped in and saw her in the rehoming ward here.
Here?
Yeah, I'm a traffic police officer, as is my wife, Jeannie. And we know the people here very well, and we quite often call in. I just saw her and I thought, well, she looked so sad for herself, though she was very friendly. I went home and spoke to Jeannie, and she came and saw her the next day, and we said, oh yes, we'd love to have her.
Do you have any other animals?
Yes, another 14 cats.
Really?
All from here, all rescue cats.
Later that afternoon, Adam removed the wire from Viv's jaw, which had healed perfectly. By the next day, she was back at home. Mike and Jeannie had taken the day off from traffic patrol.
Oh, hello, Jeannie.
So Shauna went to see how Viv was doing and to find out more about their 14 other cats.
So how's Viv getting on?
Well, she's getting on very well. We collected her last night and we kept her in our room overnight. But this morning she's fine and demanded her breakfast. So yeah, she's fine, isn't she?
All of Jeannie and Mike's cats have come from Putney. They were all abandoned and unwanted, and many have survived serious accidents. They introduced me to some of their favourite characters.
Right, this is Basil. Call him Basil because he's only got one eye, so he's Basil 40.
This one's little Lucy. She was flushed down the toilet as a tiny kitten. She's paralysed down her right side, but she's a lovely little girl.
This is Lizzie. She's my favourite. She was so skinny you could almost just pick her up with one finger. I didn't think she'd last more than a couple of weeks, but that was 2.5 years ago.
This is Albert, and as you can see, he's only got 3 legs. He's our original cat. He's my favourite. I love him to bits.
Why do you adopt cats like these?
I think a lot of people, when they go in to see them in the homing ward, and most of them aren't particularly attractive looking, especially if they've had a traumatic experience, an accident, they've lost a leg. And we've found that they're so loving that we'll always consider homing a cat that's like that.
With so many hungry mouths to feed, Mike and Jeannie need to be highly organised. Each cat has its very own bowl.
Do you want me to give you a hand?
Yes, please.
Yeah, okay, well. Okay. Billy.
Rosie.
Okay.
Percy.
Billy, come on, sweetheart. Okay, Thomas, this is your bowl. Thomas, not you, no, Thomas. Okay. Okay, feeding time. This is pretty hard work, feeding 15 cats.
It's an ongoing thing, especially with 15 cats that you need medication and treatment for, so it's not a matter of just dolloping out the food.
No.
It is hard work.
But it's definitely worth it. I mean,
Yeah.
to see their little faces, it's gorgeous, it really is.
It's nice to see those cats getting that little bit of extra love and attention. If you'd like to rehome any of the animals you see on the program, please don't ring the hospital. You might stop an emergency call getting through. All the information you need is on CFAX page 628. Now, there are some animals that need more expert care than others. Reptiles are particularly difficult to keep, even when they're perfectly healthy. And it's very easy to get it wrong, as Shauna found out when vet Tessa Bailey had to treat a very unusual animal.
This is Hector, who is a Basque monitor lizard who was brought in by his owner last night. He is extremely poorly. He's very emaciated, very weak. He's not able to walk very well, and he's got quite a curvature of his spine. He's got some terrible burns underneath, which are now getting very sore. Now, it may be from lying on a dirty surface, but it could also be if he's had a hot heating pad, which they should have some heat, but if it's been too hot or he's been too weak to move away from it, then that may well have caused the burns.
Ooh, that must be quite painful.
I just think it's extremely painful, yeah, poor thing.
So what are you going to do now?
We'll get some x-rays and see if there have been any breaks in the bones in his back and his leg bones, and see how strong they are at the moment.
Hector was x-rayed straight away by visiting vet Felipe Lopez Dugarry. The results were better than Tessa had expected.
His bone density is not bad. His feet are a bit faint, and the edges of his ribs, but there's no sign of old breaks, because if their bones have been weak, very often you see old fractures that are starting to heal. So it'll mean that we don't have to worry too much about handling him now, and we can start giving him fluids and treating the sores underneath.
The first treatment was to give him a gentle soak in warm water.
The gloves are just to make sure he can keep his head up comfortably, so he's not going to be straining to keep his head above the water.
Oh.
They wouldn't routinely need bathing. This is more as hydration fluid and to get his temperature up.
He seems to like it.
Yeah, probably feels much more comfortable. It'd be soothing on the sore skin underneath as well. It's a much safer way of warming him than using a heat lamp or a heated pad with that soreness there.
So how often will he have his bath?
Well, hopefully today to get him warmed up and rehydrated, and then he'll go into a vivarium, and he's going to have regular iodine bathing for the burns underneath as well.
Do you think he's going to pull through?
I'm quite worried that he might not, but he's got a chance, and you know, we'll do everything we can and see how it goes.
To start with, Hector did seem to be getting better, but Tessa's worries were justified. Despite all their best efforts, his burns became infected, and a few days later, he died of blood poisoning. Now, in case you didn't know, this week is National Pet Week, and one of their aims is to get people to realise that owning a pet can really be a big responsibility. This is certainly true for one owner, whose dog Camber was admitted to the hospital, suffering from an insatiable thirst and dramatic weight loss. After a few days of tests, nurse Deborah Forster explained what they'd found.
The vets took a blood sample from him, and his glucose levels were really quite high, and it did prove a diagnosis of diabetes mellitus. We have to start him on insulin injections. Once we've got him fairly stabilised, we like to get the owners in. You know, it is quite scary for them, especially when they have to learn how to give the injections and be confident to give them correctly.
The next day, Camber's owner, Robbie Roberts, came in with his daughter to see vet Liz Forbes.
He's much better. He feels much brighter. And we have confirmed he is a diabetic. So I just wanted to chat to you today, just really to tell you the way we treat it, because it isn't something, unfortunately, that's going to go away. It's something that we're going to have to monitor quite closely, and you're going to have to, do the treatment at home.
He will survive, will he?
Well, we've seen a lot worse, certainly.
Oh,
And
that's encouraging.
I mean, because he's diabetic, he may eat lots, but the insulin inside him is not working enough to take the glucose out of his bloodstream and into the cells, okay? So that, in effect, the body is being starved. So what we're doing with him is giving him synthetic insulin every day to replace the insulin that he would normally have in his system. So that's your job. That's going to be your job every day, to give him an injection.
Oh, yes. You're going to show me how to do that.
I'll show you how to do it.
And where do you inject him?
You can inject anywhere under the skin. So just imagine that the dog is wearing a big jumper and that you're just putting the injection between the jumper and the dog. You just put it into his skin like that and then just inject it in. I'll draw you some up and you can have a go at injecting him. Now it's only water. There we go.
That right?
Yeah.
That's it.
All right, okay.
Sorry.
That's all right. I think you should have another go at that. Take a bit more of a handful this time. Yeah, you need
quite
to get
a handful.
perhaps-
You didn't perhaps have as much as... That's it.
That it?
Yeah, that's it. Okay.
Right.
There's this needle. I'll just hold him still for you. I'll try.
And keep it fairly level.
That's brilliant.
Perfect.
Oh, that's it.
Well done. Excellent.
But that wasn't the only skill Canber's owner had to master, as Steve Knight found out when he visited them at home a few days later.
Tumbleweed, come on. First thing every morning, Robbie has to collect a urine sample from Canber.
Come here. Yes, sometimes he doesn't want to do it, you see. So what you have to do is to get him here like this. Believe it or not, I've lifted his leg up for him.
You're cocking his leg for him.
That's right, yes. Good boy.
Yeah.
That's enough. Thank God we only need a few drops. No problem, Mike.
Once Canber's done his bit, Robbie and his wife Jean use the sample to work out exactly how much insulin they have to give him.
There we go. I'm just going to test his urine. That's the first thing we have to do in the day. That.
Yes.
Right. Now, according to the colour of this, we can determine the amount of insulin he's going to need. Now, this looks good.
Oh, yes, it does, Robert. Because
That looks very good.
It was the green yesterday.
It's blue, which means that there's very, very little insulin needed so that the diabetes is stabilised. It once went up to orange there.
And then we got real
Then we got really frightened. Now, the next thing you do is to inject him with insulin. And this is the part I hate, but it's...
But it's very cool.
Here we go.
And Canber doesn't even mind.
No.
So this must be a terrible burden for you to do all this, isn't it?
Oh, it's no burden. It's a joy to look after him. Now that I'm confident. When I was uncertain, I was extremely worried.
Because it must be fantastic for you to see him, back to normal, really.
It broke our hearts. Such a beautiful dog.
He's obviously in very good hands. Now, a surprising number of wild animals live in big cities. And although they usually manage pretty well, at this time of year when they have young, they sometimes need a bit of extra help. Last week, Steve went with ambulance driver Dermot Murphy when he set off to rescue a family of ducks after their mother had decided to nest on a balcony in London's Docklands.
What's probably happened is she's nested in the plants or the bushes in the corner there.
Yeah.
I mean, the water's not far away, although it is obviously a silly place for her to nest because there's no way for her to get the ducklings out. It's very common this time of year that the ducks will nest in the most awkward of places.
To give the ducklings the best chance of survival, Dermot wanted to move the whole family together, but his big worry was that the mother would fly off.
You did well there.
Yeah.
I mean, it looks really brutal, but...
It's the only way, because she's going to fly off.
There you go.
Okay? Yeah.
Without their mum, the ducklings began to panic.
We can just gather them up as quickly as possible.
All right.
Oh.
There we go. 3 here. Tiny. I think they're only about, a couple of weeks old or?
A few days.
No, a few days old.
A few days.
There we go.
It's probably the last one.
Yep. So how many is that now? Is that it?
That's 14 in total.
14. Dermot hoped he'd be able to release the family nearby.
Yeah, actually there's a lake through here, I believe.
Oh, is there?
Yeah. This is a lovely little setting for them, actually.
The plan was to release the ducklings first, so hopefully when the mother was released, she'd see them and stay with them. For the ducklings, it would be the first time they'd ever seen water.
So are they going to be able to swim?
Yes, they will. All the time they've been with Mother. She's been preening them, getting them oiled, waterproofed, ready to go out where we are now.
Right. Okay.
Right, let's open them up and just start dropping them in.
Straight into the water?
Straight into the water.
Go on, little fellas. You can jump. Go on, off you go. That's a good sight, isn't it?
It is. We need to move quickly so that we can get Mum out to them as quickly as possible. Come on, there we go.
Well, that part was easy enough.
And one more.
Next, the moment of truth. Would the mother stay with the ducklings?
That's a good sight, isn't it?
It is. The perfect ending.
That's great. Isn't it incredible? They all knew exactly what to do once they were on the water. Those ducklings were so appealing, but you know, sometimes appearances can be very deceptive, as I found out last week when a beautiful French lop-eared rabbit called Jeannie was brought into Liz Forbes' clinic.
How old is he now?
He's 5.5 months. But he's very aggressive now.
Is he?
Has he just got aggressive? Just started to get
yeah,
aggressive?
just in the past week. He bites me every day.
Oh dear.
This one is very serious.
How does it happen then?
Well, he was lying on the floor, and then I was bending, you know, to talk to him, and then he just jumped and bites me, and then he hung.
With all his weight on your chin?
Yeah. I have to squeeze his mouth to get him out.
Screaming all the time, were you?
Yeah.
Not funny. Not
no,
funny at all.
not at all.
Oops. Just trying to just have a quick look at his teeth.
Is it common for rabbits to get this aggressive?
It's not common, certainly, but there are rabbits that people are frightened to go and get them out of their cage and can't handle at all. I'm sure it's nothing that you've done wrong. It's just the way that he's suddenly become mature and reaching puberty, and just really trying to become dominant. I would hope that getting him castrated will hopefully stop him developing a habit of being nasty.
If it doesn't work, what will you do?
Well, actually, my mum said, oh, I should rehome him after he bites me on the face. But I don't think it's a good idea to rehome him, so... Well, I'll keep him anyway, you know, even if he's aggressive.
It might take a while for the hormone levels to go down. It's not going to change him overnight, so you're going to have to perhaps ignore him for a while and keep him away from you. If he's doing you damage, then certainly keep your faces away. That's how castration works.
I gather the operation has done the trick. He's already being a lot more friendly. Now, last week, a call came into the inspectors about a little dog that had been reported left in a back garden for several days. And apparently the dog also had a bad leg. Inspectors had been unable to contact the owner, so the front door was taped up to see if anyone was going in or out. Inspector Gary Lucas went back to check.
This lock here, the tape's been broken, so someone's been in, as you can see. There, let's have a knock on the door. Tin of dog food in there, been opened, but other than that, nothing.
So Gary went next door to find out if he could see the dog over the neighbour's fence.
Come on then. Hey, yeah, there he is. Hello. There he is. Come on then. You see his back leg? Yep, holding up. There he is, limping on it. Quite a friendly little chap. What I need to do is have a look at that hind leg. I'm not happy about it at all.
Gary called the police for some help.
Hello, it's the police.
And after double checking that no one was home, they managed to get in by a side entrance.
Come on, come say hello. Come on then. Oh, sweetie, hello. How are we doing? Come on. What have you done to this leg? Hey, what have you done to this leg? Why won't you put it down? Oh, look at those toenails. Right over there, look at that. And into his paw. Poor chap.
Gary also wanted to see the conditions that the dog was being kept in.
Hang on, chap. Oh, some food here. Looks like there's rainwater all in that. I don't know when that was placed there. Not touched it. Now it's got a little cat basket here. A lot of hairs in it. A bit wet. It's pretty much a makeshift, isn't it, really?
Gary decided the best thing to do was to take the little dog back to the hospital in Putney. Vet Julie Taylor was on duty.
The first thing I would notice is that this dog looks like she's been clipped up sometime recently. So she's had surgery recently on this leg. She's got quite a big scar on the top of her leg as well, up here. Oh, I'm sorry. I'm sorry. If we can just sort of pop her on her side there.
Go on, good girl.
Whoa,
whoa,
good girl. Just want to feel her knee. All right. She's really not flexing that knee very well, and I can feel underneath the skin, I can feel some metalwork in her knee. So I think that she has had some sort of surgical procedure on her knee, because I can feel pins through the skin.
So was I right to be concerned about the dog?
Yeah, I mean, I think she's not using the leg because it's uncomfortable for her. If she's been left out in the garden, if she hasn't been having the right post-operative care, then it kind of defeats the object of even doing the surgery in the first place.
What do you think we ought to do now?
Well, I think we're not going to get an answer really about what's going on until we x-ray her, so I think we might as well go ahead and x-ray her.
While the dog was being x-rayed, the staff decided to just check and see if they had any record of her at that address. And amazingly, they had. She had had a fracture repaired at Putney back in December.
This is the x-ray. This dog was supposed to be back for checkups about 6 weeks ago, and they didn't bring the dog back, and now we've got a problem. The pin's moved. It's sticking right into the kneecap at the end here, and it causes a lot of pain every time she tries to move that joint. So what we need to do is operate on her now and move that pin back, see if that feels stable. If it does, we'll take the pin all the way out.
As soon as the dog was ready for the operation, Julie set about removing the pin.
Okay, I'm just feeling along the fracture line, trying to hold the two pieces of bone and feel if it feels what they call rotationally stable, as if the fracture's not moving around. Yeah. And that feels pretty good. So I'm going to go ahead and take her pin out.
Well, didn't expect it to come out as easily as that. What is the best outlook now for her with the leg?
I'm really hoping that now that she has the pin out, that she will be comfortable enough to start to use her leg again, and she'll build back all the muscle that has wasted on her leg and get a more mobile leg, because the alternative for her would be having her leg amputated. And it would be a great shame to go through all of this, have a fracture, have it fixed, and then have to have your leg amputated afterwards.
And here she is, lovely little dog. It turns out she's called Louisa. There's still no sign of her trying to use her leg, and it could be several weeks before Julie will know whether the leg has been saved. But at least she's feeling more comfortable. Meanwhile, the RSPCA are investigating the case. Well, that's all we've got time for. Join me at the same time